Hi, I'm Meshal Malik and you're watching Indus Special. India, home to over 1.3 billion people, had taken strict measures early on to curb the coronavirus outbreak. However, despite these measures, it has become the third worst affected country after the United States and Brazil. How's the country coping and planning as cases rise daily? We discuss this further. Joining us for this conversation is Mr. Vijay Grover, who's an analyst, joining us from Bengaluru. Also joining us today is Dr. Srinivas Rajkumar, who's the General Secretary of the Resident Doctors Association at the All India Institute of Medical Sciences. He joins us from New Delhi. Thank you both for joining us and welcome to the show. Mr. Vijay Grover, I'd like to begin with you. Now, as we talk about this outbreak, it being a global phenomena, we also have to be cognizant of the fact that each country has its unique context. In this case, when we talk about India and the fact that even though it imposed a stringent lockdown, it's still so badly hit. What do you think are the main reasons for that?
Well, see, Michelle, one thing that we need to take into cognizance over here is, this is something where the numbers might look very big as far as, that's purely because of the population. But if you look at the percentage-wise, I don't think so Bangalore has been as badly hit, or, I would say even India, for that matter, has done comparatively a far better job than many other countries, which may show, overall quantum of number may be less. But the fact is that, India has, with a population of 1.3 billion, we are now at a situation where we're just talking of maybe a million cases, just above a million. So this is something where, you need to compare with very clear fact that, this was something that was anticipated. This was something that we were mentally prepared for, that we would come to a scenario given the population. I mean, if you're comparing with number 2, Brazil, the population there and you see the number of cases there. Or if you're talking of Russia. So these kind of things where we were anticipating, yes, it is tough to, fight, I would say, this kind of a pandemic, because given the high population densities that are there in urban areas, but we have islands of exemplary performance. I mean, there are states which have done a very good job. And that is like if you look at the entire Northeast, or if you look at states like Goa or states like Pondicherry. So they have done a phenomenally good job. And there have been pockets which were there purely because of population density, that things did go out of control, but it is not alarming, I would say, at the moment.
Well, Mr. Grover, stay with me. There have been more than 28,000 deaths so far in India. And as you say, even though a million cases might seem not as significant as compared to the population size, they are still a million cases. And I'm going to come back to what you've said here, but I want to jump to Dr. Rajkumar and talk to him about what you have said here. Dr. Rajkumar, now you are on the ground as a doctor who's dealing on the front lines of this. Do you as well agree that India has done fairly well?
So it's a mixed bag. So the initial lockdown-based strategy was to completely eliminate the virus, in which we have not been successful. For example, countries like New Zealand, which are isolated islands, have been able to eliminate the virus completely. The second usefulness of lockdown is to limit the number of cases that appear or add up to the already existing pool every day, so that the health sector is able to cope up. Now, after the prolonged lockdown which the country had imposed initially, now you can see several states, several cities imposing isolated lockdown. So we are following a mixture of both the strategies. We have delayed the onset of the pandemic in its severity, and again we are imposing temporary lockdowns to ensure that the health sector is able to cope up. But Delhi has adopted a completely different strategy. So after the initial central government imposed mandatory lockdown, we have completely opened up the businesses and other facilities, and we have seen a sudden upsurge of cases in Delhi. So at the peak of the pandemic, there was around 4,000 cases per day, and now we have brought it down to around 1,000 cases per day. So Delhi claims to have flattened the curve. So India, considering the magnitude of population and the diverse kind of facilities and the knowledge of the population available all over the country, the pandemic has followed a completely different path. But it is also important to note that though Delhi, the number of cases have decreased from say 4,000 at the maximum to around 1,000. You can see the daily addition is around 40,000 new COVID cases per day, which is highly alarming. And states like Bangalore are facing cities like Bangalore are facing difficulties in getting arranging.
Dr. Srinivas, Rajkumar, sorry to interject here, but that point I want to pick up on. When you say it's highly alarming, given the context, the situation that Mr. Vijay Grover painted for us, given the population size, given the measures, given that it was expected, as it is happening all across the world, that numbers would increase. Why do you think it's particularly alarming?
If you are not able to treat the people who fall sick, the situation is alarming, be it a city or be it a state or be it a country. So the preparedness is always based on how well are you able to treat the patient who are falling sick, and what is your overall response to the pandemic as a whole. What is its impact on the health sector? What is its impact on the economy? And what it holds for the future. So we have to keep all those aspects into account before claiming that we have fought this well.
Right. I'm going to go back to Mr. Grover. And Mr. Grover, as you mentioned before, I said I was going to come back to this point. You said that the situation is being taken into control given how we compare it to other countries, the population, the proportion of people who have been impacted. One thing I do want to pick up is the trend. Now, we heard what Dr. Rajkumar talked to us about Delhi, but when we look at states like Kerala, which did fairly well in the beginning and were being lauded as an example in South Asia, not just India, now their trends seem to be going upwards. Is that alarming for you?
Yes, Michelle. I would say, I would make the example of Kerala. Kerala was the first state to get prepared as early as January. The state health minister there, teacher Sushila, as she's called, had started working on creating a task force as early as January, even before the first case was recorded in India. And, she knew, because anticipating that a lot of migrant population would come from the Middle East or would come from China in Wuhan. Especially, there were about 400 students from Kerala who were studying in Wuhan at that time. So she had prepared for it. And, similarly, Goa also had locked itself in a very good way. Unfortunately, we've seen this upsurge after international flights have begun. And, we've seen a lot of people from the Middle East, especially Kuwait and Dubai, started returning, and many of them turned positive. This was something which certainly was a setback. It could have waited, or, it was something which would have, given some more breathing space to Kerala or a state like Goa, which at one stage became corona-free. So this is something where we need to, the compromise. The governments have a huge challenge of, how long can the lockdown sustain? Right. That was where we saw that, the conflict of interest of economy versus the lockdown has been the biggest debate that we have seen, because, if people don't die of corona, they would die of unemployment, or, they would die of hunger. So this was something where, the governments have had pressure. But I think so India has largely done a great job as far as, balancing these kind of activities is concerned. We've had pockets of surges, like in some instances in Mumbai, or what we are seeing now in Bengaluru, or what Delhi experienced. But apart from that, largely, if you see, India has been able to sustain the corona cases. Somewhere down the line, I think so, what we have done with the extended lockdown, or what we are able to manage, is that the pressure for bed availability has got staggered. And, the only game that we need to fight in this is, the cases would come. But with lockdowns, if we are able to stagger the rise of the curve, that is something is half the battle won, because, right, we want the people will go to the hospitals, but at what pace, that we need to decide, we need to control that.
Mr. Grover, as you say, it's like there are pockets where we're seeing a rise in numbers, but when we look at the southern states, it seems like a pattern all across, almost a trend all across. What are the main reasons for it? Are they the same as migrant workers returning home? What is really driving up those numbers in those areas?
Yeah, well, see, if I were to talk about Karnataka over here, or Bangalore thing, I mean, it's only after Mumbai started registering huge cases, we saw a lot of migrant population of Karnataka, which was working in Maharashtra and Mumbai, in the hotel industry and the restaurants in other allied sectors. It's when they came down, the numbers which were reporting at 50 a day or 100 a day suddenly saw they went up to about 500 a day. And after that, there was no looking back because, many of them started interacting with the locals. And, this was where there was a trend where we saw that, certain cities, certain pockets started registering huge numbers. Somewhere down the line, yes, the government could have been a little more strict with the way it is doing it now, in the sense like, migration from Maharashtra to Karnataka has been stopped for the moment. Per day, only 1,000 people can enter the state. So this kind of restrictions are now have been put in place. But since this is a pandemic of a stage where none of us knew anything about the background of the virus, and today we are learning
Right.
as we are moving ahead every day as to how to battle it. And that's something where we feel that every day we see these kind of learnings, and the fact that today Karnataka is able to use technology, is able to use infrastructure, and is able to use tracing. That is
Right.
one of the biggest successes that we've had, that we are able to trace the contacts of a
Mr.
positive
Grover, that's
and
such an
ensure that
such an important point in there, and I definitely want to talk about how tracing is being done in a population of over 1.3 billion. But before that, I want to jump to Dr. Srinivas Rajkumar and talk to him about what we are seeing as anecdotal stories and accounts emerging, especially here in Pakistan, which is that the virus is becoming weaker, that the patients who come to the hospitals have weaker symptoms. Is that something that is also being witnessed in hospitals in India, and especially where you're talking to us from?
There is no scientific evidence to back this claim. The recently released ICMR Zero survey says that 23% of Delhi's population already has antibodies to the virus. So we should be very clear that the proportion of individuals who were tested initially was very less, and the counts which are shown are a gross underestimate from the real number of people who are infected. So what you are saying is, as the testing has improved, we are able to detect more number of people. So previously the criteria was to test only people who are exhibiting symptoms. So when the testing is obviously expanded, so if we reach the WHO recommended positivity rate of closer to 5%, you will always find a large number of people who are asymptomatic or who are mildly symptomatic. And that is not based on the nature of the virus. It is not about the nature of the virus of it becoming like mild or severe. The virus is virulent as it is. The mutations in the virus have made it more virulent, but not less virulent. As of now, the data suggests that the virus is virulent. We have to be careful and we should take sufficient protective measures. As the testing improves, obviously when the denominator improves, you always find that the numerator is low. The proportion of patients who exhibit severe symptoms or who die or who require ventilator will be less. So
Right.
that is depending upon testing capacity rather than the nature of the virus. So it is very important we take sufficient precautions and never underestimate the ability of virus to cause death and disruption in the healthcare sector or in the economy or the preparedness we make.
Right, those are very important words. Rajkumar, one thing I think is always important to do when we talk about COVID-19, especially when we have individuals such as yourself who are working on the front lines, is to give us a perspective of what exactly the on-ground situation in the hospitals looks like. Not to create panic or alarm, but for people to be aware of what the gravity of the situation is.
So there was initial difficulty for hospitals and even like very big hospitals and other infrastructures to handle this increasing number of cases. And there was also difficulty in organizing the workforce to comfort them about the nature of the virus, to make them work. So there were certain difficulties, but over time people have understood about how to take precautions, how to wear a PPE, how to assess the quality of the PPE, how to follow proper donning, that is the wearing and the removal of the PPE, how to keep yourself and the people who come in contact, the patients and other people in the public, when you are on COVID duty, how to interact with your family members, the provision of quarantine in some hospitals, like before going and meeting your family members. So a lot of arrangements at multiple levels, both by the coordination of the hospital administration with the government, and again the information, education and communication to spread the awareness to general public. So a lot of measures were taken in unison so that the healthcare facility, the government, and the people put up a coordinated fight against this virus.
Right. And one of the essential components of fighting this virus is testing, tracking, and then making sure that there's effective quarantine. Mr. Vijay Grover, we just glossed over this point previously, but it's really important to talk about how in a country which has such a massive population is tracing and tracking being done. How are measures evolving in order to keep up with the situation?
Well, Michelle, one thing that, as I was telling you earlier also, and we were talking about it, tracing and tracking is something which is becoming the key to fight. And that is something we've seen earlier in Rajasthan when the German tourists were found, that we could locate them and, isolate them. And after that, we've seen the Dharavi model, which is now called, Dharavi. If you remember, the initial surge that was there was certainly a huge challenge. But after that, the Mumbai Mahanagar Corporation, they ensured that they got into the tracking model on a very strong way. For every positive that was detected, 15 of his primary contacts were isolated or monitored for what symptoms they showed over the next 10 days. So this was something which did become the Dharavi model, and we are doing it here in Bengaluru as well now. From the last 1 week, Bengaluru has been divided into 8 sectors, and these sectors, every positive case is traced, tracked, monitored, and we take care of, who all were in contact with him and isolate them as well. Now, this is something which is helping in controlling the rapid rise of cases. That is something we have seen that, where we were doing about 2,000 cases per day last week. We are now down to about 1,500 to 1,400. That is something which is reassuring that we are in the right direction. But it's not to stop at that. It's also the fact that, what is important in this entire case is the crisis of bed availability. So what we've seen is there has been a crackdown now because a lot of private hospitals were giving preference to asymptomatic cases occupying beds, whereas somebody who was symptomatic needed more medical attention was unable to find beds. So there has been an intervention in the last 2 days where people who could get cured in the residence of their house or on a COVID care center, the government has made massive COVID care centers where asymptomatic people or people who don't need as much medical intervention are taken care of and freeing up beds which is needed for people who need them more. So these are the kind of things that we need doing juggling around, I would say, to ensure that people who need medical attention first get the bed first. And that is something that we hope that in another week or 10 days, if not going higher, at least we would have flattened the case, the curve in a city like Bengaluru, which has seen this surge in the last 3 weeks, where from 200 cases a day, we went up to 2,000, and we are now down to about 1,500 cases a day.
Right. Mr. Vijay Grover, now as we talk about how the situation is being dealt with, how measures are being rectified, I just want to read out a title by the Indian Express that says, despite government claims, migrants continue to be vulnerable and abandoned. Now, this is a situation that we saw very early on during the lockdown. We saw very horrific pictures of migrant workers, and it seems like the situation still persists. What more can you tell us about that?
Well, Meshal, one thing about the migrant crisis, yes, that was a very unfortunate chapter. I would say that, where a lot of us failed in terms of understanding the panic that was there. Primarily, this is something which is, common to not just India, but many other countries where the literacy rates are lower, especially the workforce. And, the fear that had got onto them saw rapid migration where people, opted for moving out of cities and back to their homes, and that was a panic. Now, luckily in Bengaluru, one thing was very clear is that, the government ensured enough trains were provided, and the instructions from the top over here were to ensure that no migrant went hungry. And I personally myself worked with a couple of friends. We ensured that in our free time we could, help the migrants board the train, provide facilities to them, provide food to them. And this is something that we have done as a continued process. So that is something which was a very unfortunate chapter, I would say.
But it seems like it still is persisting as a problem. It seems like it's still persisting as a problem even today.
That, we did detect that, there was a migrant camp where there were 22 cases positive were detected a few days back. But that would be purely because of, the negligence that was shown in the interaction. And that's something where, the employers have been taken to task, where they have been hauled up by the authorities that, why proper social distancing or usage of masks and all, precautions that need to be taken were not taken.
Right.
But this is something which will continue. But, these kind of clusters need to be prevented from forming. And this is not just specifically to Bengaluru, but I would say that in any urban infrastructure, be it Manila,
right, it's something that runs across the board. Mr. Grover, I would have liked to pick more on this point, but since we're short on time, I'm going to ask one last question to Dr. Rajkumar. Dr. Rajkumar, now we know that across the world, health infrastructure was not expected to cope with a situation of this magnitude, of a pandemic of this scale. But when we talk about social security nets, and especially, as I mentioned, the migrant workers and other vulnerable populations, how do you think India's government is trying to ramp up efforts to include more vulnerable people in the healthcare system in order to provide them the necessary services?
It's actually moving towards an insurance-based model to ensure minimal amount of care. And even to healthcare workers, some kind of insurance has been extended. But it is important to understand that healthcare facilities cannot be made up in a day. Even if government assures about like home isolation, then the temporary facilities, which is shown in the visuals as COVID care centers. So these are temporary makeshift arrangements. In a country like India, we always know that 1.4%, 1.8% of GDP, and the actual investment is around 0.8% living around other schemes. Such investment is grossly low because we should have around 4% of GDP investment to maintain a sufficient healthcare for any population. So these short-sighted measures will not be able to cope up or meet the healthcare demands in future, even for regular healthcare needs. We always know that even on a regular day, getting healthcare facility for laborers or other people in underprivileged section of the society or people who are living in states with poor healthcare has always been a difficulty. The COVID has just exposed or widened the fault lines which were already existing in the healthcare.
Right.
So it is a wake-up call for all governments across the world to spend more on public healthcare infrastructure and not focus on involving privates or making it public and private partnerships.
Health infrastructure needs to be the priority. I take your point there. Sorry for cutting you off, but we have run out of time. Thank you so much, Dr. Srinivas, Rajkumar, for joining us, Mr. Vijay, Grover for joining us. We're going to go for a short break. When we come back, we take a look at how the world of sports is keeping up with the pandemic. Stay with us. Welcome back. Now, like everything else, the massive global sports industry has also been hit badly by the pandemic. On today's show, we talk about how exactly these unprecedented times are impacting the games and the players. Joining us today is Aisam-ul-Haq, a professional tennis player who is Pakistan's most successful singles and doubles player, winning the most Davis Cup matches for the country. Thank you so much, Qureshi, for joining us and taking out the time to talk to us. Now, let's just jump right into it. Let's begin with your sport. As a sportsman, playing tennis professionally and not being able to do that during this time, how do you feel?
First of all, and thank you very much for having me on the show. Well, the coronavirus, the pandemic has affected everyone and all over the world, and especially the sports as well. Tennis in specific, because it's an individual sport, more than 140 countries are actually affiliated with ITF. And when we're playing the Grand Slam and the ATP events, players are coming from all over the world. So it has definitely affected tennis and the players as well. I haven't played any tournament since March. My last match was actually Davis Cup, where Pakistan plays Slovenia in Islamabad. Yeah, the last time I played a match, actually competitive match, was on 10th March. So it's been a while, and it feels very strange. I was expecting to enjoy this kind of lifestyle once I was retired. But due to the pandemic, I'm kind of getting a preview of it. And everywhere, all over the world, I have so many friends from all over the world, and everyone has been affected. There's still so many countries that are still in lockdown. There's still players who haven't practiced for 3 months. So it's a bizarre scenario, and I just hope everybody can come out of it in a strong way, in some way or the other.
Right, everyone's hoping that something good comes out of this time and everyone emerges stronger with this. But Mr. Qureshi, as you mentioned, you haven't practiced, you haven't played a tournament. How important is that for your sport specifically? And how important is that for any sportsman? How integral is that for their career?
I do understand and see now that some of the places in the world are getting better and sports is getting revived. You can see football also. The Premier League is back on track, and so is the Bundesliga and the Spanish League as well. Tennis tournaments are going to get revived in August. So far, our calendar has come out, and we're planning on having US Open at the end of August, and then French Open, Roland Garros at the end of September. So I'm a little bit excited about it, but on the other hand, a bit scared as well, because the situation in America is still pretty scary. Right. There are cases coming out right, left, and center in Miami and Florida and Houston. So I'm still debating on it, whether I'll go or not. But it has affected everyone, especially individual sport. I think for us tennis players, it's all about hand-eye coordination. It's all about movement on the court. And when the clubs are locked down and you can't really do these kind of drills to work on your hand-eye coordination, with the ball on the court is very, very difficult, because our sport is all about movement. And we can't rely on other players or other athletes to substitute us, like you can have in cricket or football or other team sports. Everything relies on us. Everything is basically depending on our physical ability and capabilities. And I think once tennis gets revived, there's going to be a dip in the quality of tennis, and it's going to take some time for all the players to get back to their best and to peak probably around September, October time.
Right. Now, you tell us your personal hesitations, of course, as they are about going and playing in these professional matches, given the situation. But if we talk at a wider scale about the conversations happening now, like Djokovic had an exhibition series earlier last month that, of course, caused a lot of controversy when him and 3 other players turned out to be positive with the coronavirus. Berlin just had a massive exhibition series. Given all of this that is happening, raising a lot of red flags in a lot of people's minds, what is the larger conversation? How are these tournaments impacting or shaping the way forward?
Yeah, it's been a very, very scary scenario. Obviously, Novak tried to hold this tournament in the best of his minds, and he wanted to promote tennis in a way in his country and try to revive tennis, but kind of backfired. And it just showed the importance of social distancing. And about this virus as well, it doesn't really matter about the immune system. No matter how strong it is, it can get anyone. These guys are the best athletes in the world, and coronavirus is affecting them directly. So it puts a very strange, I would say, scenario for other tennis players as well. Everyone is scared to go to America right now. I think it's a little bit too early to go to states, especially. The European Union's got sanctions on America that people from America or Americans are not allowed to travel to Europe. And so for me as well, like if I go to America to play, I'm not really sure how I'm going to come back to Pakistan or go to Europe also. There's no clear-cut rules or regulations about that right now. So I'm hopefully in the 3 weeks' time after Eid, there are going to be some better news and some better restrictions or rules that players can apply and follow to make it easier for them. But right now there is a mixed feeling among players. Most of them that I've spoken to, they don't really want to go to America. And they think that it's a bit too early for the tournaments to revive, especially in the States, where the coronavirus cases are actually still on the rise. I can understand in Europe, maybe the cases are on the downside. Schools are opening, the shops are opening, the restaurants are opening. In London also, in France as well, where they're planning on having the Roland Garros, and in Spain also. So if things are getting better in these countries and cities, I'm sure following the right SOPs through those countries and from those countries, we can have a healthy tournament, but all of them need to be without the crowd. I think there's still, we need to follow these SOPs of social distancing. I think having the tournaments with crowd are going to be just pushing it a little bit too much. And yeah, but that's why I'm saying I don't think we're going to see the same quality as before, because being an individual sport, you take a lot of energy from the crowd. And all these top athletes, they're used to playing on bigger stadiums with packed crowds, like 15,000, 20,000 people watching them. And now nobody watching them is going to definitely play its role in the big tournaments.
I'm really glad you bring that up, and about how important the crowd is for these scenarios, as we're seeing empty stadiums for many sports and the conversation around it. Now, as a player, you mentioned here that the energy is very important, but to what extent does your performance rely on the crowd existing there?
No, crowd plays a big part, especially in individual sport. You take a lot of energy. Sometimes there's so many matches that people actually end up winning because of the crowd boosting them. There's so many players who win a lot of matches and tournaments in their home countries because of their home support. You will see the record of Spanish players winning in Spain. French players are known of performing their best tennis in France and not anywhere else. And so are the Americans. Americans come out and play lights out tennis when they're playing in the States in front of their home crowd. So without the crowd, I think it's going to be a totally different ball game and totally different scenario. Players obviously are not used to it also. And it's going to be, a strange atmosphere and kind of lonely one as well. While you're going to be the only person out there competing and you'll only probably have your coach or trainer to be supporting you. So difficult times and different times, I think we just need to learn how to cope with them in the best way possible. And more important thing is for all these international sports to revive and somehow we can get back to our lives and can play competitive tennis for the fans also on television. I think this year, in my opinion, we shouldn't be playing any tournaments with crowds. I think any sports. I think we need to give coronavirus at least a year. And this is the best way to keep the social distancing as well.
Right.
But players need to compete. We need to revive their games everywhere in the world. And hopefully we can get back on track next year with everybody coming and watching live tennis as well.
Right, because sports is not just entertainment. Livelihoods are attached to this entire industry, and it has shattered so many lives across, as the pandemic has with other industries. Now, I do want to talk about the work you have been doing throughout this pandemic, especially in collaboration with the Risk Foundation. Tell us a little more about it.
I started this collaboration, obviously, once our country went into lockdown from 20th March onwards. And Risk and my foundation called Stop Post Start Tennis, we collaborated together to distribute ration bags among the needy and the poor and the daily wagers affected by the pandemic. There are so many people obviously getting affected by the virus, but I feel there are more people actually getting affected because of hunger and deprivation of food in Pakistan. And our target was before Eid al-Fitr to reach 10,000 families. And alhamdulillah, we were managed to support 15,000 and more before Eid al-Fitr. And after Eid, I've been going on ground with Risk team, door to door, distributing ration bags. And once you go in person and see the ground realities that are so harsh, it's an ongoing process. There are still so many communities that are in smart lockdowns and they're not allowed to leave their homes. They have no livelihood. They don't know how to earn money or feed their families. So I started Stars Against Hunger campaign, in which I'm mobilizing international and national superstars and icons, collecting their signed memorabilia and auctioning them off to raise funds. And all these funds are used to distribute ration bags amongst the daily wagers and the needy people here in Pakistan. And in the past month, through this campaign, we have been able to raise 9 million rupees and have supported 1,500 families already. And inshallah, before Eid al-Azha, we're planning to reach a target of 2,000. And then inshallah, after Eid, a total of 10,000 families, inshallah, to support through this campaign.
Right. It's a wonderful initiative and so much good is coming out of it, especially how you are providing a platform for other sportsmen, other people of the industry to come forward and help those who need it the most during this time. Thank you so much, Mr. Aisam-ul-Haq Qureshi, for joining us and talking to us from Lahore. Now joining us for this conversation is Mr. Taimoor Waqar, who's the head of the Corporate and Commercial Asian Hockey Federation. He joins us from Lahore as well. Thank you so much, Mr. Waqar, for joining us and welcome to the show. Now, when we're talking about the sports industry at large and how deeply it has been impacted, many people don't understand, or many people aren't aware of the invisible costs of it. Can you take us through those?
Obviously, these are very difficult circumstances for all of us, whether it's be sports industry or commercial industry or whatever. But Obviously, there are costs involved, there are commercial partners involved, there's events involved. Events is one of the biggest things that feature our costs, our planning, everything around the stadium. As you can see, the video you're showing, there's so much involved in it that we as Asian Hockey Federation have come up with basically 2020 was one of the biggest years for us. We had our Olympic Games planned in 2020. We had our Men's Asian Champions Trophy. We had our Women's Asian Champions Trophy and a few Men and Women Junior Asia Cups planned for 2020. So obviously a lot of resources are involved, a lot of costs are involved. And there's no such way of minimizing these costs in terms of when a pandemic strikes because nobody predicts these things. So in order to move forward, we obviously had to develop a task force which would make decisions, which will have the right knowledge about how it's impacting the policies, the government policies, the travel policies, and then we move forward in our planning and in terms of reducing the main costs.
Right. And now, Mr. Waqar, as you mentioned, 2020 was a very, very important year for hockey, especially in Asia. And now, given the scenario, things have turned upside down. How do you see things moving forward? And especially for hockey, will it take a lot of time for it to revive?
Well, obviously, as working in the Asian hockey, we hope not. And we are keeping very positive in terms of bringing hockey back. So, as I previously mentioned, that the Olympics have been postponed from 2020 to 2021. The calendar has been released already for 21. It will be taking place in July and August. As far as the Asian hockey events that come under our umbrella are concerned, we have obviously, due to our planning is done previously a year ahead or 2 years ahead. So some of the events we obviously didn't have in mind. The pandemic will strike and what will happen. So the main events that I was talking about, the Men's Junior Asia Cup, the Women's Junior Asia Cup, and the Women's Asian Champions Trophy, those were scheduled throughout Asia. So obviously those will not go ahead as planned, but we have sent out notices to the participating teams, to the national associations, keeping positive and planning and rescheduling those events. We are obviously not going to cancel them. We will focus on the government policies, we'll focus on travel restrictions, we'll contact with the local governments, the hosts, and everyone, and we'll plan those events safely. And for our Men's Asian Champions Trophy, we have still not given up, and we are still hoping to take that event through. It's planned in mid to end November, and we are keeping positive, and inshallah we'll go through with that because that's one of the biggest events under the Asian hockey umbrella.
Right. Now, sportsmen have to train with everything you're saying that lies ahead. Of course, that is naturally an expectation and something that they have to do. How does that happen during this time?
So we've already recently concluded a survey as well, where we sent a questionnaire to all our national associations, because we also need to know that what is happening around in the world of hockey, what the national associations are doing. We're in contact with them. So we heard some really positive news. In China, Japan, Korea, Chinese Taipei, India, a lot of countries have already resumed hockey activities or training sessions, something involving hockey, whether it's training, whether it's club matches, whether it's national level matches. Obviously, they're taking care of themselves, they're following all rules and regulations. But the positive news is that hockey is returning in a lot of countries, and national teams and club level teams have already started working on it.
Right. That's, of course, important to be in contact with all the other associations abroad, all over the world, trying to create a coordinated effort in strategy creation and the protocols that are needed. Now, when we talk about this pandemic, we, especially on this show, we've had several conversations about how there will be permanent changes that come out of it. Do you see that happening for the world of sports?
Well, obviously, one change that we weren't really involved in was once the pandemic hit us, we started off with an initiative called Development Through Distance. This initiative was keeping in mind that the events have been postponed, but we need to keep our officials, our coaches, our umpires always ready, refreshed, learning different things. So this initiative basically included courses and workshops for umpires, coaches, and technical officials with one of the best and elite level coaches or other officials from throughout the world. We also included African hockey in this, the African Hockey Federation as well as the Asian Hockey Federation. And we've also done a lot of things with our respective national association, identifying their needs, how they can improve, where they can improve. And obviously, once hockey resumes, we are positive, but we are also not under any false hope. There will be changes. There will be security protocols that we need to follow, safety protocols that we need to follow. As you might have seen that currently in football, the game has resumed, the national leagues have resumed in England, in Spain, in Italy, but they don't have any fans. So yes, that is something that we do have in mind, but obviously we're hoping for the best, and hopefully with the right measures we can bring fans in the stadiums as soon as possible as well.
Right, on that point, thank you so much, Taimoor, Waqar, for taking out the time and talking to us, and good luck to you and all those who are trying to revive the sports industry, who are working tirelessly in order to somehow keep sportsmen and those who are attached to this industry not out of work, but continuing the projects that have been ongoing. Thank you for watching Indus Special. We will see you again tomorrow with more stories. Till then, goodbye and take care.